Welcome to Group Health Cooperative of South Central Wisconsin, commonly known as GHC. We are a member-owned health plan providing health care to over 70,000 members in South Central Wisconsin. GHC is a nonprofit cooperative, which means we reinvest our resources back into our members and our community. At GHC, our members always come first, not profit. And we firmly believe that healthcare is a human right. This year, we have two main plan options for State of Wisconsin and Public Employer Group members, Dane Choice and Neighbors. Each plan has its own set of counties served, healthcare systems, and provider network. Members will have the option to choose either the Dane Choice or Neighbors plan, regardless of where they live or work. All dependents on the subscriber's plan will automatically be enrolled within the same plan the subscriber selects. Subscribers and their dependents cannot be enrolled in different plans. For Dane Choice, our service area is strictly Dane County and includes our very own GHC clinics. We also partner with other health systems, including UW Health, Unity Point Health Meritor, and Access Community Health Center. One notable update for the 2026 plan year. In April 2025, we opened a brand new behavioral health location on Allen Avenue in Madison, replacing our former downtown clinic on Regent Street. Here is an overview of what cities in Dane County have an in-network primary care clinic. As you can see, this includes most of the major cities and towns within the county. There are also several hospital options in Madison and one in Stoughton. This is a full list of all the clinics that members who have the Dane Choice plan can choose from for primary care. This includes 5 GHC clinics: the Capitol Clinic, located downtown Madison, the Hatchery Hill Clinic in Fitchburg, Sauk Trails Clinic on the west side, the East Clinic, and a clinic located at Madison College's Truax campus. The hospital and surgery centers located within the Dane Choice plan are shown on the right side of the screen. The second plan option is Neighbors. This plan serves Columbia, Juneau, and Sauk counties. We partner with Asperus Health, Mile Bluff Medical Center, Prairie Clinic, Reedsburg Area Medical Center, Sauk Prairie Healthcare, Upland Hills Health, and the UW Health Portage location. Members who select this plan can choose a primary care clinic in one of the healthcare systems listed here. A couple of important changes for 2026. We no longer service Grant, Iowa, Jefferson, and Lafayette counties. We pared back our counties to focus more on our core geography in and around Dane County. As for location updates in the Neighbors plan, Mile Bluff Medical Center moved its Mauston Urgent Care to a new location on Gateway Avenue and is no longer located at their main hospital campus. Here is an overview of the cities in Sauk, Columbia, and Juneau counties that have an in-network primary care clinic or a hospital. Members who select the Neighbors plan will still have access to specialty care, hospitals, urgent care centers, and emergency rooms in Dane County. This is a full list of the locations, and on the right side of the screen are the hospital and surgery centers in the Neighbors plan. All members, whether they select the Dane Choice or Neighbors plan, will have access to our GHC urgent care, located downtown Madison at our Capitol Clinic. These are appointment-based, not walk-ins, to better serve our members' same-day access needs. Members can come to the GHC urgent care for most non-emergency medical conditions. One of GHC's most valued member benefit is GHC Care on Demand, giving you virtual care access whenever and wherever you need it. There are 5 different virtual care options that fall under GHC Care on Demand. GHC Nurse Connect is a 24/7 nurse advice line. By calling this nurse line, members can get general care advice for several conditions, such as a cough, cold, fever, flu, or sore throat, address their health-related concerns with a registered nurse, and get out-of-area care for temporary illnesses or injuries. GHC MyChart video visits are an alternative to in-person visits at a GHC clinic. With these video visits, Members can safely visit with GHC healthcare providers and receive the same exceptional care experienced at a GHC clinic. A GHC provider will discuss the member's concerns, answer their questions, and recommend a treatment plan. These visits are billed the same as in-person visits and can be scheduled for preventive health exams, routine office visits for sudden minor health conditions, follow-up visits, health screenings, consultations with specialists, dermatology visits, behavioral health appointments, physical and occupational therapy visits, and health education visits. For unexpected concerns, our 24/7 virtual urgent care is available, which is powered by a platform called KeyCare. Virtual urgent care is available 24/7 and gives members live virtual access to licensed providers, whether the member is at home, the office, or on the go. Members meet with these providers using a secure video. Most members receive unlimited and free visits. These visits are meant to treat non-emergency medical conditions. Some examples include allergies, cold, fever, sore throats, ear problems, rashes, constipation, and headaches. 24/7 e-visits are similar to virtual urgent care, but instead of meeting over a video, members connect with licensed providers over messaging, which is also powered by the KeyCare platform. Members connect with the provider electronically from their home, office, or on the go. They can send messages and photos for symptom review to help treat any non-emergency medical condition. These visits are also free and unlimited for most members. Similar to virtual urgent care, e-visits can be used to treat conditions like allergies, colds, fevers, and rashes. It's also a quick and easy way to get a routine medication refilled. The last option for GHC Care On Demand is 24/7 virtual therapy, which is powered by the MD Live platform. With virtual therapy, members can access licensed therapists and psychiatrists from their home, office, or on the go. Visit either by phone or secure video to help treat any non-emergency mental health condition. Again, most members receive unlimited free visits. Common conditions for virtual therapy include counseling, anxiety, isolation, panic, addictions, child or adolescent behavior issues, loss, and grief. To help members navigate their plan, they can visit our dedicated webpage for the state of Wisconsin and public employer group members. There, they can find 2026 provider directories and maps, summary of benefits documents, urgent and emergency care info, virtual care options, and more resources like advanced care planning guides. To find a provider, members can visit our website and click the Find a Provider button on the upper right-hand side of the page. Once on this page, there are options to search by either provider, behavioral health provider, or clinic location. A pop-up box will open. Under the drop-down menu, members can select State of Wisconsin employees and either Dane Choice or Neighbors. From there, they can filter to find the right clinic or provider for their needs. Member ID cards. For 2026, new members will automatically receive a new ID card. Existing members will only get a new card if they change their plan type or primary care provider. This helps GHC reduce waste. Here is an example of what the GHC member ID cards look like. As you can see, it includes member and group information, their primary care clinic location, a brief benefit overview, GHC contact information, and a summary of our virtual care options. For any questions, our Member Services Department is available weekly by phone or email. In addition to our own resources, please visit the ATF website for information as well. That concludes our 2026 plan overview. Thank you for your time today.